A very good afternoon and a warm welcome to you all on behalf of Birla Hospitals, CMRI, once again to our yet another Facebook Live session. Well, today we are going to discuss about the urology related problems and the probable way out of cure during this pandemic time. And to talk about that, it's our pleasure to have with me right now the consultant urologist, none other than Dr. Pankaj Kumar Gupta. So welcome to this Facebook Live session. So as we all know that COVID has become a part of our life and it has changed our lifestyle as well. But it's not only the one disease which is around. There are other multiple deadly disease which needs to be addressed before it's too late. So my request to you, doctor, if you kindly let all of us know that why we should address the other problem rather than COVID.
Definitely. First of all, I must say that it has been almost more than a year we are facing this pandemic situation.
Absolutely.
And we are actually hiding our previous situation, previous problem, medical related diseases and everything, because we don't need to go out. We are not trying to move out because other diseases are not important, that's are not deadly. But closing your eyes doesn't mean that everything is gone. You're still having
True.
your problem. You are somehow managing under teleconsultation, or you are going to some pharmacy nearby and getting some medicines and getting relief of your symptom. But that's not the treatment. If you are having a bigger problem, suppose you are having recurrent stone problem, you are having much painful situation, you are having bleeding in your urine, and still you are at home, that may be something which you should go through as urgently as needed.
So as you are talking about some diseases, you have taken some name. I would like to know from you that what are the major disease which comes under this urology?
See, urological things first you should deal with. First, go to the symptom. What are the symptoms?
Yeah.
If it is mild, suppose a mild pain because of some small stone or some UTI kind of thing, that can be treated. Mild UTI can be treated at home with teleconsultation and others. But suppose you are having severe recurrent pain abdomen, severe pain abdomen because of suppose a stone, okay, or infection, then you must consult someone. You should reach a hospital with definite precaution. Definitely you should take all the precautions whichever is recommended by the government and local authorities, and then you should visit a consultant, because every time it is not possible to treat you with, on the basis of your investigations which you have gone through teleconsultation, because we need to examine the patient somehow.
True.
So that is not possible online. So you need to visit us. So now suppose it's a stone problem that is causing much pain, you should come. Suppose it is recurrent, it is not going, then you must come, because your kidney may be in problem. It may cause kidney failure even.
True.
Suppose you are having bleeding, that may be because of your malignancy, cancers. So that cancer may be in kidney, that cancer may be in the prostate, that cancer may be in the bladder. If it is not evaluated and treated timely, everybody knows what happens to the cancer, because it has got log growth. So if it is treated timely, that's the best time to treat. If not, then I think everybody will put hand over, but it's not the time. And radiotherapy, chemotherapy, and that's not the usual treatment we advise in urology. Urological malignancy, most of them are surgical disease.
Point to be noted, ladies and gentlemen, as doctor said. So, doctor, I would like to know from you that what are the advanced surgeries can be done under the roof of CMRI with the help of your skilled hands?
Almost everything we can do here,
Okay.
including laparoscopic surgery, including your genitourinary reconstructive surgery, including your with the help of laser. What we do today is usually prostate surgery we are not doing with the laser, and the best part about CMRI is we are having 3 lasers at a time.
Okay.
None of the hospital I think is having 3 lasers, 1 thulium laser and 2 holmium lasers. So we are doing prostate surgery with the help of laser. Even if you are having kidney stone of a small size, suppose less than 2 centimeter, okay, we can go to RIRS, that is retrograde intrarenal surgery, which is the latest surgery in case of renal stone, which can be managed endoscopically. We need not puncture you, which is usually called PCNL. So that actually removes the major contraindication, you can say the complication of the surgery, which is bleeding. So if you are undergoing RIRS, the bleeding part is gone.
Okay, so you are saying that minimally invasive surgery, bloodless surgery, less pain, this kind of
exactly.
surgeries
and
we can do
most of the
to our
surgery is now
patients.
getting done under daycare surgeries. Okay.
Okay. And what about prostate surgeries? How you take care of those
Prostate.
bad
I
prostates?
want to say something to the patients who are facing prostate problem. Those who are taking medicines and they are doing well. No need to come out of your house. No need to come out. Just be on your therapy. Continue your medicine. But those who are really having problem, obstructive voiding symptoms are still persisting. You are having symptom that cannot be relieved by the medication. You are having bleeding. You are having recurrent urinary tract infection. Then please come out. It is the time you have been vaccinated. Okay, with all precaution, you should come to the hospital and get proper treatment.
Okay, so sir, there is another question I would like to ask that can I undergo the treatment or a surgery, kidney stone surgery during this pandemic time? Is it safe?
What I'm telling, most of us have been vaccinated, and
Yeah.
vaccination is going on in full fledged. Okay, so now with all hospitals are maintaining the protocol.
Absolutely.
Even in the
We are
remote area,
doing.
even in the remote area, it's not about the hospital, not about the doctors. Even in the minimum person who is living in the remote area of the India, he also knows what is to be maintained, what is to be so maintain that precautions. Come to the hospital, and definitely everything can be done, and we are doing it right now.
Oh yes, absolutely, without any fail. And sir, there is another query is coming to my mind that post surgery, suppose my surgery has been done, and post surgery, will I be prone to the infection of COVID, or I will recover now
See, yes,
normally?
because we are maintaining all the protocols. Okay, so we are separating our patients from the COVID
Yeah.
patients. Okay, and before coming to the hospital, you are getting done. Your RT-PCR has been done.
Mm-hmm.
So you come when we are admitting. Until otherwise, it is emergency. So
Mm-hmm.
emergency treatment can be done even if it is positive patient. Suppose the
Yes.
patient comes with the bleeding, even if it is he or she is COVID positive, we need to intervene. We need to do surgery on them because that is an emergency surgery. But for elective surgery, we are doing it prior to the admission that RT-PCR should be done. He must be admitted in the negative ward. Okay, we are not exposing our positive patient to the
True.
negative patient. We are taking all the precaution to shift to OT. In OTs, there is no mix and match. Okay,
Absolutely.
okay.
Absolutely.
So we are taking all the precautions. So and after surgery, definitely, if you are going home on way, you can get the disease. Okay, nobody knows where from the disease come. But as I told, everybody is taking precaution nowadays. Everyone.
True.
Okay.
So need not to fear about getting surgery done in case of emergency. So
Especially
we
in
are here
urology,
to
most of the surgery are minimally invasive surgery. We don't
yeah
open too much.
yeah
Okay,
yeah.
so patient comes and goes home back in just 2 or 3 days. So I think people can think of the surgery right now.
Does kidney disease create more risk gathering infection
See,
of
there are
COVID
two kind
19?
of patients: those with a normal kidney function and those we say kidney failure patients. So definitely, normal kidney patients are as comparable to normal patients. Okay, they are not excessively exposed or predisposed to the disease. But if you come to the kidney patient, those who are dependent on dialysis or those who have underwent transplantation, so most likely everybody knows that the immunity power of the body goes down, and especially in the transplant patient, we keep it down with some medicines. Okay, so they are definitely exposed, but that doesn't mean they should not be vaccinated. They should be vaccinated as per the protocol decided by the AIMS and the authorities over the, we know the genuine authorities, they have defined that all the patients who are undergoing dialysis, those who have been transplanted should be vaccinated. Because that's the way you can prevent the disease. Otherwise,
Absolutely.
you have no way out. And along with the treatment, along with that, you should continue all the treatment. You should continue dialysis. You should continue all the medication advised by your transplant surgeon.
Okay. And sir, what about the urinary frequency? Can it be a reason of or a symptom of COVID
See now,
19?
because this is a new disease, so studies are going on, and it has been a study that there is something called COVID-induced cystitis.
Okay.
Okay. In previously, it has been found that almost most of the viral diseases like HIV, you see there are symptoms, urinary symptom like frequency, urgency. These are the common symptoms. So virus can also cause cystitis. So
Okay.
that
Okay.
that has been proved by the study of the interleukins in the urine. It has been seen that the interleukin, as because the whole body interleukin levels are going high because of the inflammatory phase. So that is also existing in the urine. Okay, so if you do urine culture test, then it will come negative. If you do other infective features, okay, that will come negative because it is not the bacteria. Because we send urine for culture for bacteria. It's not for
True.
virus. So even if it comes negative, that doesn't mean that there is no infection. It is viral cystitis. Okay, so the pus cell may be some bit higher. Okay, accordingly we have to treat it not with the antibiotic. So antibiotic is for bacteria. We are
Okay.
treating here viral cystitis. So
Okay.
anti-inflammatory is the treatment of choice.
ওকে আর
Okay.
স্যার আপনি যদি আমাদের একটু বলেন যে ইউরিনারি আর রেনাল প্রবলেমস এই ডিউরিং প্যান্ডেমিক টাইম আর কোভিড-19 যে সময়টার মধ্যে দিয়ে আমরা যাচ্ছি নেগলেক্ট করাটা একেবারেই উচিত হবে না।
Exactly what I'm telling you. Previously, people used to come with small stones, a small malignancy, cancer of very small size. Now, for last 1.5 year, most of them have managed somehow with medications. Okay, so disease is still there, but it's not coming out. So what I was telling, closing your eyes doesn't mean it's dark. Okay, you have to come somehow. You have to get it treated. Okay, timely treatment is very important.
Very
Okay,
important.
very
Yes.
important. Timely treatment is very important. So if it is there, you should get the treatment. Okay.
Absolutely, sir. And otherwise, also, I would like to know from you what will be your message regarding the overall health.
Overall health, everybody knows, stay safe, stay healthy. Okay. Mm, take all the precautions. All the government and local authority, whatever measures they have taken, follow that, because it's ultimately your life, your risk. Okay. If you are thinking that you are not at risk, everybody is at risk. Me, you, everyone is at
True.
risk. So it's for us only. You have to take care of yourself. Okay.
True.
Don't think about others. If everyone will take care of themselves, it is done.
True.
Okay, the disease will go one day. Everybody knows that pandemic has to go. Okay.
And sir, nowadays kidney stone is the another disease that commonly found.
Definitely. and
So,
it's
any
one-
preventive care or measures you would like to mention
Yeah.
for our
It is
viewers?
one of the reason for kidney failure also. Okay. So in cities, what we find is smaller stone because they present very early. But if you go to remote area, they are presenting with a bigger stone, big size stone, 4 centimeter, 5 centimeter. The whole of the kidney is full of stone. What they causes recurrent infection in the kidney. So kidney function is deranged. Most of them come with kidney failure. Okay, because of obstruction, because of the stone. So these need to be addressed as quickly as possible. I think these patients should be treated on an early basis, and those who were definitely very health conscious previously, they used to undergo yearly checkup, which is pending for most of them, I know. Okay, because they are not coming out, the yearly checkup is pending. So now is the time after vaccination most likely, and it is going on. If anybody wants to come, they can get it done, and proper treatment should be done accordingly.
And you would like to share any tips for our viewers that how we can actually
For a stone,
get ourselves protected
for a
from
stone, one
kidney
thing was
stones?
pending. One thing was pending. 3 things is very important. Drink adequate water. Don't drink too much of water, otherwise you have to go to loo again and again. Second is avoid protein. So people are taking protein.
Yes.
Protein.
Nowadays, we are only
everybody is
talking
talking
about
about
proteins.
protein. So those patients, especially those, not for everyone, but those who are predisposed for the stone formation, for protein-rich diet can cause the recurrence of a stone.
Okay.
So one
Okay.
way they are somehow managing something but creating another problem.
So very important message doctor is giving.
And
Please
third,
hear him.
Yeah. And third is definitely salt. Don't take extra salt. Whatever is there in the cooked food, don't take extra salt or salty things.
Okay,
That's-
so this
that's
is the
it.
way we can definitely take care of ourselves, and we can we cannot neglect our health by taking all this precautionary
Get
measurement.
vaccinated, everyone. Please get vaccinated.
Yeah, and this is the way we are at the end of our session, and this is the promise. We will definitely come back soon with another Facebook Live session. And now I have to say goodbye to you all. Take care of your health. Take care of yourself. Mask up Kolkata. And still, if you have any other queries, you can always contact us in our helpline number, which is 033 4090 4090. Till then, thank you so much.
Thank you very much. Namaskar.